Welcome back to Balanced Health. Joining us now is Dr. John Plant from the Illinois Urological Institute to update us on the risk factors, signs, and symptoms of prostate cancer and some of the other men's health issues, and to answer some questions. Welcome, Dr. Plant. So nice to have you with us.
Well, it's a pleasure to be here.
And this is a very important topic, and I think it's very close to home to me because my husband did have prostate cancer about a year or so ago. He's doing great, but it is very, very prevalent in our country. And I want to ask you just at the get-go here, what are some of the most important issues you're seeing, say, in men in their 40s, 50s, and 60s?
Well, you have to remember that prostate cancer is quickly approaching the prevalence of lung cancer in males. And
wow.
With time in the next few years, I'm sure we'll see it surpass lung, especially people are not smoking as much as they used to.
Is it because men are living longer?
They're living longer. They're being detected when they weren't being detected 20 years ago.
Okay.
So there's a lot of things demographic-wise that go into the fact that prevalence is really increasing. Okay. And for men, it's the number 2 cancer right now in the United States.
Wow, amazing.
You hear these comment that if every man lived long enough, 100% of them would get prostate cancer. Are we talking about an enlarged prostate, a poor functioning prostate? Are we talking about actually cancer in the prostate gland?
These issues come from post-mortem studies that have been done over the years. And when they do post-mortem studies on people in their 80s, they will find that a significant number of these individuals will have prostate cancer if you look at their prostates in detail. Now, the argument with those people, is this clinically relevant prostate cancer, or is this a pathologic finding that absolutely has no clinical relevance? And that's probably what that means.
Well, that then begs the question, what if nobody was ever seen for prostate cancer? In other words, if apparently some people were diagnosed with prostate cancer, or not diagnosed with prostate cancer, and died of something else. You know where I'm going with this.
Correct. Well, it all depends on your age, of course. It depends on your age. It depends on things like the PSA. It depends on things like the biopsy, if the cancer is there, that allow us to determine, is this going to be a biologically aggressive tumor, or is this a tumor that perhaps we can adopt a watchful waiting strategy for? Because
many of them are aggressive, and many men do die of prostate cancer.
Correct.
It spreads to the bones and other organs, correct?
Correct.
Now, as a cancer goes, this is one of those cancers that's kind of different in that the younger you get this, the worse the prognosis is, right?
Well, the younger you get it, the tumors tend to be more biologically active. But if you compare people at age 60 or age 45 who have stage for stage the same disease, their survival should be identical.
Okay.
Lately, there's been quite a brouhaha about the whole PSA early diagnosis of prostate, where the information that I recently looked at said that there doesn't seem to be an ultimate difference in outcome based on earlier diagnosis or having the PSA checked constantly, that maybe the PSA isn't the marker of cancer that we thought it was. I'd like you to address that. I think that's...
You could put 10 urologists in a room, they could argue this, debate this point.
And nobody would win.
And nobody would win. You have to remember the PSA screening is a good test, but it's not a perfect test. Mm-hmm. In a perfect world, you'd have a marker that said, every time this marker was abnormal, that person had prostate cancer. Unfortunately, we don't live in a perfect world. We live in the world that, that we've been given. The PSA is a good test for screening, but it has limitations. I think it belongs in every man's annual physical, especially if they're over age 50 for white males and African Americans over age 45. And the individual needs to talk to his doctor and find out about the pros and the cons, and to make an informed decision on how to screen with the PSA and how to interpret the results.
Mm-hmm.
So if somebody's high, it certainly is a good argument to intervene further.
Have a biopsy or something like that?
Well, I always tell everyone, if it's high one time doesn't count.
Okay.
Repeat it, because there can be lab errors, and there can be also variability in an individual from time to time. Right. So you want to make sure that before you undergo any invasive diagnostic tests, that you really have a true reading.
Okay. That's very logical. So if it's below PSA, what might take you to the next level would be the physical exam, maybe?
Exactly. The physical exam is always part of the annual screening test. And you want the PSA level, which is the blood test, and the physical exam obviously is to feel the prostate. Now you can very well have a normal PSA level and an abnormal physical exam, and of course that abnormal physical exam would then demand further diagnostic tests as well.
If a man has prostatitis, which for many years just kind of a chronic thing, or if he tends to have an enlarged prostate, is he any more susceptible to getting prostate cancer?
People that have benign enlargement of the prostate tend not to have any higher degree of prostate cancer than the general populace. People who have chronic prostatitis have a slightly higher risk than the general populace.
Could you explain the difference? Because I think we know, but perhaps our viewers
Chronic prostatitis is chronic inflammatory condition of the prostate. And people have symptoms such as painful urination, frequency of urination, discomfort in the prostate area, and they can be caused by bacteria, can also be caused by chemicals, stress, a variety of things.
My husband used to always get it when we traveled. He would almost always, flare up. He was out of town somewhere.
Right. And they usually respond well to a course of antibiotics. And a lot of people can have this, every year, every 2 years, every 6 months. So it's very common, especially in your younger males.
When you say frequency of urination, is that frequency of non-productive urination? So in other words, if somebody urinates more than what would be considered average, but it's a normal flow and it's a normal amount, is that still indicative of a compromised prostate?
No, because you can have polyuria, which is frequent urination of large amounts.
That's a kidney thing, right?
Well, it can be from a variety. Diabetes can actually present in that fashion. But when we talk about frequency, we're talking about small, frequent voids. So there's small amounts, and it's all the time. It's when people are saying, you spend an inordinate amount of time in the bathroom.
Or you have to get up several times a night.
Several times at night, exactly.
That's not productive.
And you're not emptying completely in a lot of cases, exactly.
So that's because this gland is large, it's inflamed, and it's squeezing on the urethra, right?
It's squeezing on the urethra at the base of the bladder. So it's basically blocking off the hose.
Causing a sensation that you really have to go, when in fact your kidneys would be okay if you didn't.
Well, the bladder is storing the urine, and after a while what happens is that with chronic prostate conditions, the bladder is adversely affected. So the bladder picks up these irritable symptoms that manifest as frequency and urgency and getting up at night and feeling of non-emptying.
Well, we have to go to break, but we're going to take this up in a later segment of the show. And for more information, check out www.tln.com and then click on shows and then on Balanced Health, or you can call 888-242-9393 for a copy of today's show. And coming up in our healthy cooking segment, a savory dish that will get your taste buds moving. Stay tuned.
Always love talking about food.